Welcome everyone. Today we're focusing on emotional regulation, one of the strongest predictors of later mental health, social development and academic success. Many behaviours we see in clinical and educational settings aren't defiance, they're signs of a child whose nervous system is overwhelmed. When we understand how regulation develops, what dysregulates children and how we can support them, we can genuinely transform developmental outcomes. Think of today as both a framework and a toolbox that you can use immediately. Today we'll build a shared understanding of what emotional regulation is and how it develops across childhood. We'll explore the difference between typical regulation patterns and concerning ones, and look at practical, evidence-based tools that work across both medical and educational settings. We'll also identify when a child needs additional assessment or therapy and discuss how health, school and family systems can work together to support the child effectively. We can see on this slide lots of different emotions. We all have different emotions at different times, in different circumstances, and children are no different. And it's just about recognizing what's the typical range of emotions and emotional regulation and what is more of a concerning range. But it's important to remember that the children all have different emotions, and no emotion is necessarily good or bad, just the emotions that we feel. Emotional regulation underpins nearly everything: learning, attention, behavior, relationships, and participation. Dysregulation isn't misbehavior, it's a signal that the child's nervous system cannot cope with the current demand. Research shows early regulation difficulties are linked to later internalizing and externalizing challenges, but early support reduces escalation and long-term impact. When we target regulation, we see improvements across behavior, learning, and social functioning. You can see here a diagram about human brain development and the connections that the brain makes when children are young. You can see the brain is busy making lots of connections around sensory pathways like vision and hearing, and also language, all before the age of 1. It makes lots of connections for higher cognitive functions around the age of 1, and that decreases over time until about the age of 16. And so what we want to do in early intervention is take advantage of the brain's ability to make all of these big connections during this critical window between about 0 and 16 for a higher cognitive function such as behavior and emotional regulation. Regulation skills develop gradually and unevenly. Babies and toddlers rely almost entirely on adults. By preschool, children start experimenting with simple strategies, but they're inconsistent. They still need lots of co-regulation. Through primary school, children improve but remain vulnerable to overwhelm. In adolescence, emotional intensity increases again due to brain reorganization. Regulation continues developing into the mid-20s as executive functioning matures. This explains why some children who speak well or seem bright still have big emotional responses. Language develops faster than emotional regulation. Regulation is a physical state, not a choice. When a child encounters stress, the limbic system, which is in green here, activates rapidly, while the prefrontal cortex, which is in blue in the diagram, the part needed for reasoning and self-control, activates more slowly. During high emotional states, children simply can't access the skills that we want them to use. Co-regulation is powerful because children borrow the calmer nervous system of a regulated adult. Chronic stress can heighten reactivity for a child, making it harder for them to return to baseline without support. In terms of the brain's development, the sensory pathways develop first, here in orange. Second, those in green, which is that emotional development and attachment. And then the blue areas develop third, about thinking, reasoning, learning, self-inhibition, emotional regulation, and behavior or control. When we look at a child's behavior, we have to consider the full context. A child's ability to regulate is shaped by their developmental stage, their temperament, and the environments they move through, at home, at school, in the community, and transitioning between those areas. Cultural expectations also influence how emotions are expressed or suppressed. Neurodevelopmental differences, relationships, attachment patterns, and a child's stress or trauma history all play a role. This is why two children can face the same situation but respond completely differently. The key message is behavior is never just about what we see on the surface. It reflects the child's internal state and the context around them. The diagram in this slide shows the bioecological model of human development, which is considering all of the different contexts and their influence on a child's development and their behavior. Typical emotional challenges are part of healthy development. Younger children, especially under 6, commonly have tantrums, struggle with transitions, and become upset when routines change. The distinguishing feature is that their emotional reactions are brief, linked to a clear trigger, and they settle with adult support. Over time, with predictable routines and co-regulation, these behaviors reduce. They're situational rather than persuasive. These patterns show us a child's system is still developing, but responding as expected for their age. In the diagram, it shows the social cognitive theory that cognitive factors, environmental factors, and behavioral factors are all part of a child's behavior, emotional regulation, and development. Concerning emotional regulation looks very different. Here we see daily or escalating meltdowns that go well beyond developmental norms. Children may take 20 to 60 minutes or more to recover, and they may show minimal response to adult support. These behaviors often occur across settings, at home, at school, and in the community, which tells us the child's internal capacity to regulate is compromised. Shutdowns, withdrawal, or freeze responses also fall into this category. If regulation difficulties are interfering with learning or relationships, or if we see chronic irritability or high anxiety, that's a clear red flag. Children under stress or with neurodevelopmental differences may show a mix of typical and concerning patterns depending on the situation. This slide brings two patterns together. Typical regulation includes short situational outbursts and tantrums under 6, where the child calms with co-regulation from an adult. In contrast, concerning regulation involves explosive meltdowns beyond developmental expectations, daily dysregulation, minimal response to adult help, and behavior that spills into multiple settings. Children may also show chronic anxiety, withdrawal, or shutdown behavior. It's important to remember that emotional regulation develops slowly. Infants and toddlers rely heavily on adults, and children internalize strategies only after many experiences of co-regulation. If emotional responses interfere with learning, relationships, or well-being, or if there is persistent anxiety, separation distress, or school refusal, that's when referral is appropriate. Early support can prevent these patterns from becoming entrenched. Understanding the difference between tantrums and meltdowns is essential. Tantrums are goal-driven. Children maintain some control and the behavior often stops if the goal is met. A meltdown, however, is a loss of neurological regulation. It's caused by emotional, sensory, or cognitive overload, and the child cannot stop it through willpower. Meltdowns require safety and co-regulation, not consequences. Some children show mixed presentations. A tantrum may begin as a protest, but progress into a meltdown if the child becomes overwhelmed. Recognizing the difference helps us respond appropriately and make informed decisions about referral. In the diagram, you can see reasons for a child's behavior. Many people think that children are being naughty and doing it on purpose. However, what really is behind many behaviors that are a meltdown is developmental differences. The child's tired or hungry. The child is anxious, they have sensory processing difficulties, they need connection, or they have an unmet need in some area. Shutdown behavior is one of the most commonly misunderstood responses in children. Unlike meltdowns, shutdowns look quiet. Children may withdraw, avoid eye contact, hide, freeze, or become completely still. This can easily be misinterpreted as refusal, oppositional behavior, or disengagement, when in reality, the child is overwhelmed and the nervous system is going into protective mode. Shutdowns are particularly common in autistic children and highly anxious children, and they are a sign that the environment or demand has exceeded the child's capacity to cope. Our response should focus on reducing demands, softening the sensory environment, and gently re-establishing safety, never pushing through the shutdown. When we look at behavior as the symptom, not the problem, everything shifts. Behavior is almost always an outward expression of an internal experience. Stress, anxiety, frustration, sensory overload, communication challenges, or developmental differences. Important underlying contributors include anxiety disorders, autism, ADHD, learning difficulties, language delays, sleep problems, sensory processing differences, trauma, or family instability. Many children are not trying to misbehave, they're trying to cope with something that feels too big. When we ask, what is this behavior communicating, we open the door to more compassionate and effective support. We can see in the diagram the difference between the visible behaviors at the top of the iceberg, such as aggression, withdrawal, rigidity, and stereotype behaviors, and then the underlying neurodevelopmental challenges that are not visible, such as emotional self-regulation, motor planning, learning disabilities, speech delays, and sensory sensitivities. And the developmental model treats the whole child and tries to look at the underlying neurodevelopmental causes of the visible behaviors. This model reminds us that regulation builds from the bottom up. At the base are physiological needs such as sleep, hunger, safety, and managing sensory load. If those aren't supported, higher level strategies won't work. Next is co-regulation, where children borrow the calm of a regulated adult. Above that, we look at environmental structure, such as visuals, routines, transition supports, and reducing cognitive load. Then comes emotional coaching, naming feelings, validating them, helping children understand what's happening in their bodies. At the top are independent strategies, which only develop when the layers beneath are stable. Children simply can't move up the pyramid unless the lower layers are in place. Co-regulation is the foundation of all emotional learning. When a child is overwhelmed, they need a calm, steady adult to help bring their system back into balance. Helpful strategies include lowering your voice, slowing your breathing, reflecting the emotion you see. For example, you're feeling really overwhelmed. And reducing sensory input. We offer connection but don't force it. We narrate instead of instructing, and we keep language minimal. These simple adjustments create safety and help the child's nervous system settle so they can return to learning or engagement. You can see in the diagram to try to think about understanding the function of the child and their behavior. Are they trying to get attachment or coping? Are they trying to get a particular skill that they don't have? Are they trying to get regulation? Or are they trying to get away from some of those things? What needs are going unmet, possibly for the child? How do you think that the child is feeling? And what do you think that they are trying to say? Even if they're not using their words to say it, what are they saying with their behavior? Often the environment, not the child, is the challenge. Small environmental changes can dramatically improve regulation. Predictable routines, visual schedules, and clear transition warnings reduce uncertainty. Calm or quiet spaces give children a safe retreat. Adjusting noise, lighting, or seating can minimize sensory overload. Sensory tools like headphones, movement breaks, deep pressure, or fidgets can support children in staying regulated across the day. These strategies support the nervous system so children can participate more effectively in learning and social activities. And in the diagram, they have 12 ways to self-regulate, which contain some different ideas that would be suitable for children. You have to think about what is going to work for the particular child in question, and sometimes that may need a trial and error approach. Emotional coaching helps children make sense of what's happening inside them. The basic sequence is name the emotion, validate the emotion, and provide support. When we put words to a child's experience, for example, you're feeling frustrated, that makes sense. We help reduce confusion and shame. Tools like a feelings thermometer, which is shown on the slide, or simple scripts, for example, I can handle big feelings, or your body is telling us it needs something. Give children a framework to understand their emotions. These strategies strengthen emotional literacy, and over time, this reduces behavioral escalation because children can express what's happening before it becomes overwhelming. Once children have the foundation of co-regulation and environmental support, we can teach more explicit regulation skills. These include breathing techniques like balloon or box breathing, movement or sensory circuits, grounding and mindfulness, and simple problem-solving frameworks. Social stories and role play help children rehearse strategies ahead of time, and cognitive reframing, like the "is this a glitch or a disaster?" question, helps them put challenges into perspective. Over time, these tools build the child's internal capacity to recognize stress and regulate early. There's an example on the slide of the problem scale. From 1, a tiny problem, up to 5, a huge problem, which helps them to identify whether this is a small problem or a huge problem for them, and whether the size of their reaction matches the size of the problem. Schools play a huge role in supporting regulation because many children spend the majority of their day there. Consistent behavior plans, predictable routines, and visual supports reduce uncertainty. Calm corners and regulation breaks help prevent escalation, and it's essential these breaks are supports, not consequences. Staff training ensures all adults respond in a consistent, relationship-based way. The principle, connect before correct, reminds us that connection is what helps children return to regulation and readiness for learning. You can see in the diagram the importance of lots of different factors, especially at school. There are multiple influencing factors, that influence behavior. We consider particular emotion triggers that might trigger an incident. Look at the child's body signs and their body sensations. Think about the intensity of the emotion. Use the emotion words to label and validate their feelings. Use regulation strategies such as sensory breaks or mindfulness, and those can be taught. And look at the behaviors and how that might relate to their internal emotional state. In health settings, we look beneath the behavior, screening for sleep, feeding, sensory issues, and for anxiety or trauma helps us understand the drivers of dysregulation. We also consider neurodevelopmental conditions like autism or ADHD where relevant, and rule out medical contributors. Families benefit enormously from psychoeducation, understanding what regulation is and why their child struggles. Early referral is protective, giving families clarity and support before patterns escalate or become more entrenched. We can see in the diagram an illustration of some of the connections between the brain and the nervous system that connects different parts of the body's organs, and how that can be affected with the freeze, fight or flight responses that are physical sensations, and also social engagement. We refer when emotional or behavioral patterns are persistent, intense, frequent, cross-context, or significantly impairing. Red flags include regression, escalating shutdowns or meltdowns, or behaviors affecting learning, participation, or safety. If families feel overwhelmed or worried, that alone is a valid indicator for referral. Importantly, referral does not mean diagnosis. It's about gaining clarity, monitoring development, and bringing the right professionals into the child's support network early. Early action prevents challenges from becoming long-term barriers. When we're unsure whether a referral is needed, this quick triage guide helps us both over-referring or waiting too long. We start by asking, is the emotional regulation developmentally typical? Is it happening across settings? Is the child distressed? Has dysregulation persisted for 4 to 8 weeks despite support? We also consider the concerns of families or educators. They're often the first to notice a shift. And finally, is learning, participation, or safety being impacted? If the answer is yes to 2 or more of these questions, consultation or referral is appropriate. Early intervention is not labeling, it's protective. It gives families clarity and prevents challenges from becoming entrenched. We refer when a child's emotional development is plateauing or regressing, when dysregulation is significantly disruptive or distressing, or when social, emotional, academic, or adaptive skills are affected. Repeated or consistent concern from parents or educators is also a valid referral indicator, and safety concerns always require support. Different professionals play different roles. Pediatricians look at medical and developmental contributors. Psychologists explore emotional, behavioral, and learning profiles. Speech pathologists assess communication and social communication. OTs support sensory, motor, and emotional regulation. Behavior specialists analyze patterns and triggers, and the Child and Adolescent Mental Health Service supports complex or high-risk presentations. Referral is ultimately about widening the team around the child, not making assumptions about diagnosis. How we communicate concerns significantly affects how families respond. We focus on specific observable behaviors.
3 to 4 aggressive incidents per week, rather than labels. We remove judgment and highlight impact while also recognizing the child's strengths. We use language that is accessible and compassionate. This may be nothing, but it's something we'd like to explore together. We also consider cultural differences in communication, expectations, and help seeking. We provide clear next steps and invite parents into the process. What have you noticed at home? How can we support you? Above all, we reassure families that early identification is supportive, not stigmatizing. These case examples help bring the concepts to life. In the first case, daily 30 to 40-minute meltdowns in a 4-year-old, the pattern suggests sensory, emotional, or environmental overwhelm. An OT assessment can clarify sensory needs, while psychology can support emotional literacy and coping skills. In the second case, a 7-year-old with rigidity and overwhelm during noise, we consider autism and sensory processing differences. Referral to OT and a pediatrician is appropriate, and a speech pathology assessment may also help if social language challenges are present. The third case, a 10-year-old with school refusal, often reflects anxiety or distress. Psychology support and school well-being involvement can help address both the emotional component and the environmental triggers. These examples show how behavior is a signal that directs us to the underlying need. To wrap up this section, regulation is the foundation of behavior. When children are dysregulated, it is not defiance, it is a sign that their nervous system needs support. Emotional skills develop slowly across childhood and require thousands of experiences of co-regulation before they can be used independently. Early identification and early referral genuinely change developmental trajectories. When we support regulation through environments, relationships, and targeted tools, we see improvements across behavior, learning, and well-being. In the diagram, we can see how physical, emotional, academic, and behavioral factors are all integrated, and observations across all domains assists with early identification. These are some of the most useful evidence-based resources for supporting children's emotional and behavioural development. Emerging Minds and BU offer excellent professional learning, while the Raising Children Network is a great first stop for families looking for clear, practical guidance. Smiling Mind is an Australian wellbeing and mindfulness app with dedicated sections for children, adolescents, and families. Screening tools like the Strengths and Difficulties Questionnaire and Parents' Evaluation of Developmental Status can help identify whether behaviours fall within typical ranges or may need further assessment. The Victorian Early Childhood Roadmap outlines statewide pathways, and early childhood therapy services such as OT, psychology, speech, behaviour, and paediatrics provide tailored assessment and support. These resources work best when shared across the team, so families, educators, and clinicians are working from the same framework. Here are some frequently asked questions. What is the difference between a tantrum and a meltdown? Tantrums are usually goal-driven. The child wants something and is frustrated they can't have it. They maintain some awareness of the environment and may stop if the goal is met. Meltdowns are neurological overload. The child is overwhelmed by sensory, emotional, or cognitive input and loses regulatory control. They cannot stop simply because they want to. They require co-regulation first, not consequences. What does a shutdown behavior look like? Shutdowns occur when the nervous system becomes overwhelmed. Children may withdraw, become silent, avoid eye contact, refuse tasks, hide, or appear frozen. Shutdowns are often mistaken for non-compliance, but reflect distress and require calm, supportive approaches to restore safety. Can cultural or multilingual backgrounds affect milestones? Culture and multilingualism shape how children communicate, but not whether they communicate. Children growing up in multilingual households may mix languages or take a little longer to produce words, but foundational milestones such as eye contact, gestures, pointing, social engagement, and responding to their name stay consistent worldwide. So we remain alert to red flags even when multilingualism is part of the picture. What are the early signs of autism? Early indicators may include differences in social reciprocity, limited joint attention, preference for predictable routines, sensory seeking or avoidance, repetitive play, or literal communication styles. These signs do not confirm autism, but indicate that a developmental assessment may be helpful. How can I support a child with sensory needs? Begin by identifying triggers and thresholds. Is the child sensory seeking or sensory avoidant for each sense? Support may include reducing sensory load, offering sensory breaks, providing movement input, using noise-reducing tools, or preparing the child for transitions. Occupational therapists can provide tailored sensory strategies. What role does anxiety play in behaviour? Anxiety often presents behaviourally rather than verbally. Children may show avoidance, irritability, shutdowns, school refusal, physical symptoms, or clinginess. Behaviour perceived as defiance is often an attempt to reduce internal discomfort or regain a sense of safety. What strategies help with emotional regulation? Co-regulation is the foundation. Adults must model calm before expecting it from children. Strategies include predictable routines, visual supports, naming emotions, sensory tools, movement breaks, and structured calming practices. Regulation skills are learned gradually over years. How can schools support children with behavioural challenges? Schools can provide predictable routines, visual timetables, breakout spaces, structured transitions, positive behaviour support plans, sensory accommodations, social skills teaching, and regular communication with families. Collaborative, consistent approaches are key. What is the difference between ADHD and typical distractibility? Typical distractibility is situational and improves with reminders. ADHD-related attention differences are persistent across settings and significantly affect learning, safety, or daily functioning. Children may struggle with working memory, impulse control, and sustained attention, even with support. How can I identify learning-related behaviour challenges? Look for behaviour changes that occur during literacy, numeracy, or structured tasks. Avoidance, frustration, task refusal, or emotional escalation may signal difficulties with processing, comprehension, memory, or academic skills. A learning assessment can clarify underlying needs. Before we close, here's the key message. You don't have to manage emotional or developmental concerns alone. SLCN is here to partner with you. Why refer to SLCN? We provide specialised holistic developmental assessment and integrated therapy across communication, social emotional, behaviour, motor, daily living, and mental health foundations. We provide clear, functional reports with practical recommendations for home, kinder, and school. We collaborate with families, GPs, schools, kinders, and NDIS partners. And we prioritise early access with timely appointments available. When to refer? For any child with delays in speech, language, social, emotional, or behavioural concerns, motor or daily living challenges, executive function difficulties, regression, or persistent parent or educator concern. How to refer? Phone 0380880527, email info@slcn.com.au, find us on the web at www.slcn.com.au. If a child came to mind today, then that's your referral. I encourage you to think about the children you support every day. If today's session has prompted you to reflect on a child who may need a bit more help, that's the ideal moment to refer. Your observations truly changed developmental pathways. Early action prevents long-term challenges and empowers families at exactly the right time. Thank you for your time and for the vital roles you play in children's lives. SLCN has free screening available for schools, kinders, GP clinics, early learning centres and community organisations, and we also offer other free professional development workshops across the year. Please contact us to find out more and to book. We're here to support you, your team and the families that you work with. Some of the other PDs include understanding childhood behaviour, what's typical versus concerning, speech, language and communication development, and identifying developmental red flags. I'm here to take questions about referral pathways, emotional development or specific scenarios that you're seeing. If you'd prefer, feel free to connect after the session.